The HIEMT device uses high-intensity electromagnetic energy to stimulate the pelvic floor muscles. During the session, patients will experience intense contractions and a tingling sensation, which are expected and beneficial effects of the treatment. Before starting, it is essential to review the patient's medical history to identify any contraindications. Common contraindications include metal implants, pregnancy, tumors, or heart disorders. Always refer to the operator's manual for a comprehensive list of contraindications and precautions. Once this is complete, instruct the patient to remove any metal objects, including jewelry, phones, coins, or credit cards, as these items may interfere with the therapy. Next, proper patient positioning is crucial for an effective treatment. The patient's legs should be perpendicularly flexed, with feet flat on the ground. Demonstrate the correct posture. The legs should be slightly abducted and externally rotated, with knees positioned directly above the feet. Teach the patient to position their pelvis correctly, ensuring the weakened pelvic floor area aligns with the treatment zone on the chair. Depending on the target area, the pelvis may need to tilt slightly forward or backward. Remind the patient to sit with a straight spine, keeping their arms relaxed and resting on their thighs for stability. Verify all these positioning steps before proceeding. Once the patient is correctly positioned, it's time to initiate therapy. Select the appropriate gender and level of the preset program from the device. Press Start to begin. Gradually increase the intensity to a level the patient can tolerate comfortably. The goal is for the patient to feel gentle pulses tapping over the perineum and pelvic floor muscles. If necessary, ask the patient to adjust their position slightly forward, backward, or to the sides until the pulses target the desired area. However, their leg positioning should remain unchanged. Throughout the session, remind the patient to maintain an upright posture with a straight spine. During therapy, the process is hands-free, allowing the operator to monitor intermittently. Encourage the patient to relax. Reading a magazine or watching TV can make the session more comfortable. The therapy concludes automatically at the end of the treatment. Afterward, check in with the patient to ensure there are no adverse effects. Patient feedback is essential to confirm the treatment's success and comfort level. Lastly, be mindful of common positioning mistakes that could compromise the treatment's effectiveness. Ensure the patient does not lean on the backrest, hunch their back, lift their feet off the ground, cross their legs, or position their legs too far apart or in internal rotation. Attention to these details ensures proper alignment and maximizes therapeutic outcomes. By following these steps, you can confidently administer HIEMT therapy, providing patients with a safe and effective treatment experience.